So as for asthma management, it's essential that all asthma sufferers carry a reliever or short-acting beta agonist, particularly during pollen season. For those patients who suffer with infrequent asthma symptoms, intermittent use of a combination low-dose inhaled corticosteroid or long-acting beta agonist can be used, such as Pharmacological. If their symptoms are present most days, a regular preventer combination inhaler can be used and is probably much more effective. As the symptoms increase in severity and frequency, the inhaler dose may need to be increased to moderate or even high dose, and occasionally short courses of oral steroids are necessary, and even additional medications such as Montelukast can be added. What's most appropriate for these patients is that we have an asthma action plan, and so when their symptoms are controlled and they're not flaring up, they know what to do. If they do start to experience a flare-up, what increase in medications they need to make. But more importantly, if they do start to experience an asthma attack, that they know exactly what they need to do. So essentially, if a patient comes into you, into your pharmacy and has the symptoms of a possible asthma attack, it's important that you sit them down and make sure they're not lying flat, that they're sitting upright and taking slow breaths in and out. They need to use their short-acting beta agonist, so their salbutamol inhaler, ideally with a spacer where possible. If they're over the age of 6, every minute for 10 minutes you're going to give a puff of the salbutamol inhaler. If they're under 6, you'll do 6 puffs over a 10-minute period. If their symptoms haven't resolved, then you'll call an ambulance immediately. You may have already called an ambulance if you feel that urgency is needed, even before you start giving them the inhaler. If the ambulance hasn't arrived after 10 minutes, you'll again recommence giving those puffs as you've done before.